Today we're going to look at the appearance of heel fat pad edema on MRIs. So often when we're doing ankle MRIs, plantar fasciitis is the most common diagnosis that we're going to make for heel pain. But there is a separate entity called heel fat pad edema, which can also be a cause of pain. And today we're going to look at what that looks like on MRI. This video is part of a webinar that was done with Siloam hospitals in Indonesia. And it's a section that's been taken out. And the premise of the webinar was really that often what happens is that we look at standard imaging, give the most obvious response, but also tend to ignore or miss the adjacent signs that are also important and that we need to mention. So today we're going to look at plantar fasciitis and heel fat pad edema. There are further videos in the series that we're going to be looking at common pathologies. What is it that we should be also be assessing in addition that can occur with them? So what is that extra bit of information that you can get out of a scan and add into your report that is useful to the clinician? So ankle MRI and the appearance of heel fat pad edema today. This is another diagnosis that people come in with plantar fasciitis, and almost always it's plantar fasciitis, but occasionally you can get isolated inflammation of the fat pad. And this is just this inflammation pattern. You can get this condition where the plantar fascia is normal, but you get inflammatory change in the fat, which is plantar to the plantar fascia, so the deeper fat, and either from trauma or chronic sort of stress response. But you can also be seen in inflammatory arthropathies like rheumatoid. So the normal fat signal, this is a PD fat sat, mostly fat saturating. There's some vessels in here, there's some septa and stuff, but this is a pretty normal appearance. When you get this heel fat pad edema, what you see is more focal increase in signal. If you look at this one, we've got relatively focal increase in signal. This one looks relatively normal. The important thing is that the plantar fascia is normal. This is not a plantar fasciitis with inflammatory change that's spread into the fat. If I go back to this, we have plantar fasciitis. Very often you'll get inflammation spreading from the plantar fascia into that fat. So this is not that. You've got a normal plantar fascia, but you've got isolated edema, inflammatory changes in the heel fat. And these can eventually atrophy or fibrose. For heel fat pad syndrome, I'm not sure why I've got hell there, but there should be heel fat pad and she'll saturate. So look for PDFS or T2FS increased signal coming from the plantar fascia. The plantar fascia should be normal or very minimally abnormal. Look at a second pattern. Okay, so this one should be very, very straightforward for you. Okay, what's the pattern here? So just in your own mind, you just work out what's wrong here. Okay, lots of trauma. There's been a anterior dislocation. To see more of these educational posts, we have a WhatsApp community channel which you can join. And at the moment, we also have 10 specific courses on joints and spine that you can learn in much more detail. And if you just want to continue seeing more of these videos, you can also subscribe to our YouTube channel.